Let's talk about paraganglioma here. These are neuroendocrine tumors, meaning they can release hormones, and these tumors typically originate from the neural crest. Neural crest is seen in the embryo. This is actually in the early stages of the formation of the brain and the spinal cord. The ectoderm, one of the germ layers, assumes the role of giving rise to the nervous system, and it starts off as a neural plate, a neural crest, and cells from here would be the ones causing these tumors. All right, so these tumors can be found in one of many places. Think about the aorta, think about the ear, think about the lungs, a carotid artery, or cranial nerve. All right, so you got the idea. So they could be present. One thing that is typical is they make norepinephrine, secretion of norepinephrine. However, the issue here is norepinephrine is not converted into epinephrine because they lack the enzyme that converts norepinephrine to epinephrine. So there is usually a higher level of norepinephrine. So this reminds you of another condition that is pheochromocytoma. This is an abnormal condition related to adrenal medulla, where there is increased release of epinephrine and norepinephrine. However, one key difference is that it's not, paraganglioma is not linked to adrenal. Its source is from elsewhere. So similar to pheochromocytoma, but not exactly, all right? So depending upon the location, let's say you have a tumor in the middle ear area close to tympanic membrane, all right? So that can then lead to deafness. What if it is associated with a cranial nerve? Then that could lead to vocal cord dysfunction or airway obstruction. All right, so those are some things to think about. And then the blood pressure changes with the norepinephrine and its effect on a number of structures. You would have the symptoms and signs different in different patients. All right, and let's see what else we can talk about. It could release these tumors, depending upon the location, they could release CCK, cholecystokinin, or histamine, or 5-HT. So it's not just the hormone, but also neurotransmitter like 5-HT. And then that could lead to bronchoconstriction, you see. Those are some things to look out for, especially when you know that the patient has paraganglioma. One is to look out bronchoconstriction, airway obstruction, vocal cord collapse, and then blood pressure variation, and so on. All right, thank you.